My name is Stephen Adashek. I'm a physician and an obstetrician gynecologist. I have an office right outside of Baltimore, Maryland. I've been seeing some of my patients since 1987, and so now this has been 30 years of taking care of them from the age of 17 till now they're going through menopause. I started ordering genetic testing in 2007. Color has changed how I do testing. It's the company that actually said, we're going to make it affordable to people, we're going to bring the cost way down, and now I recommend it for everybody who meets criteria, everybody who's worried about it, everybody who has cancer in their family. And to be honest, I'll say, listen, for the price of 3 mani-pedis, you might know if you're at risk or then your family's at risk for cancers.
My name is Chris, and I am a retired first grade teacher, and I've been coming to Dr. Adashek's practice for approximately 30 years.
Well, when I first met Chris, her mother had had uterine cancer, and as a single cancer in somebody who's older, it didn't quite ring bells. I got the results, and they were positive for the same MSH6 that had run in her family. So it comes with an increased risk of colon cancer and uterine cancer, also an increased risk of ovarian cancer. So I called Chris and I said, here's how we can increase surveillance. We'll just look for cancers more closely in you than we would for others. Here's the medicines that we have that will decrease risk of cancers, and here's surgical prophylaxis, and at some point you may wish to consider that. There's really no medicine at her age that's going to decrease her risk of uterine and ovarian cancer. So the recommendations are, listen, if you're over 35 or you're done having your kids, you should consider having them out.
I was all for it. It's preventative. It might save my life. So I did, and it was the best thing that's ever happened.
She had a high-grade tubal cancer, and tubal cancer looks like ovarian cancer. It was only in the fallopian tube. It had not gone anywhere. This was going to be an invasive ovarian cancer. And by the time it starts in the tube and then leaks out anywhere, it's stage 3.
I want to live my life, and I know that I wouldn't be able to do that without color and Dr. Adashek. So I thank everybody for that.
I would recommend my peers to learn about cancer testing and genetic testing. I would encourage them to find out about what the options are out there, and no longer do they have to rely on somebody to charge $4,000 for the test, and say to their patients who are concerned or have a number of cancers in the family, here is a test that you can do for your patients that will save their lives.